Hi everyone, it's Wednesday, time for a little Wisdom Wednesday. I have been traveling and just getting back into Dallas and thought I would just do a little bit on what I do for travel in terms of trying to maintain health and my immune system in good shape, as well as just formulating a program of how to address travel, especially if you're trying to watch your weight and you want to feel good while you're gone. Some things that you might want to consider. First of all, with all things, it's about staying hydrated. When we travel, we get a little dehydrated. I was up in the mountains, so particularly dehydrated, drinking lots of fluids. But it's interesting, when you go to higher altitudes, it's not that you want to really push fluids the first day or two, especially if you have issues with mountain sickness. You actually want to try to decrease your vascular volume so that you don't get headaches or feel sluggish for those first few days. Now, you don't want to get dehydrated, but you don't want to overhydrate. And many of the ways that we treat mountain sickness, for instance, one of the things that is used most often is a medication called Diamox, and that is a very mild diuretic to kind of help reduce vascular volume, because what happens is because of the change in barometric pressure, fluid runs out of your blood vessels and into your tissues, so you feel very swollen and very uncomfortable. So just try not to overdo it the first day or two, but once you are acclimated, then you definitely want to stay hydrated, because typically it is a lot drier than it is down here. Now, as far as nutrition goes, one of the most important things is continuing, if you are doing any kind of intermittent fasting, continue to do that. And when you can, just skip a meal. And if you know you've got a big meal coming up, it's really nice to plan and have a great time. Enjoy that meal. If you're going to have any alcohol, wine, enjoy that, and try to limit as much as you can desserts as well. I typically will make a choice if I'm going to have a bite or two of dessert versus have a glass of wine or a cocktail. Try not to do both typically. And also, when you are traveling, it's important to keep that immune system in good health. So I do take some extra supplements when I go and travel, particularly on the plane. I have a little baggie of spirulina and chlorella, which are herbal supplements that help with detoxification. You're given a lot of electrons and a lot of EMFs when you travel, and it really helps to decrease that. And I just take a handful, 5 or 6 of each, and that usually does very well. There is some interesting data when you travel long distances that one of the things that can be very helpful as far as detoxification is concerned is a process called earthing, where when you have an opportunity, when you get to a new place, to just take your shoes off and walk in the grass or just on the ground to release a lot of electrons, that can be helpful as well. As far as supplements go, I do increase my vitamin D, particularly on travel days. I take vitamin C during most of as far as my supplements go, but I increase that when I travel, 500 maybe twice a day. And of course, zinc. And now that we know we've got this Delta variant, I take 50 milligrams of zinc, and I take a supplement called quercetin, 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 500, 600 milligrams once or twice a day. This particular supplement is what we call a zinc ionophore. I know I've talked about this before when we were talking about just supplements to take to prevent COVID or to help with trying to get over COVID if you became infected. Because what it does is it pushes that zinc inside the cells, and it must be done early enough so that it reduces replication of the virus. So I take some quercetin. Also, because I have a little bit of allergies to grasses, that's very helpful there too, because it helps stabilize cell membranes and therefore reduces histamine release. So quercetin can be very helpful. I also take extra magnesium. For me, when I travel, if I do get dehydrated, I tend to have sluggish bowels, so I will significantly increase my magnesium, particularly at bedtime. And if I need to, I'll take it more than once a day. I may take it some in the morning and some at night. It's very helpful just from the standpoint of helping your system continue to work well. Magnesium is involved in 300 or 400 different types of chemical reactions in the body, and we tend to be magnesium deficient. Melatonin, very helpful when you travel. We know that particularly if you're traveling lots of time zones, extra melatonin can be helpful, but also trying to time your melatonin to adjust to new time zones. There are great support and protocols online if you want to just Google that and look at jet lag and melatonin and how to address that, even up to 1 or 2 weeks prior to travel can be very helpful. I hope you all are having a great time out this summer, since we're kind of able to travel again, maybe not quite as much as we were, but nonetheless, we're traveling. Certainly the airports are full. It was crazy today trying to get home from Denver, and certainly happy to be back in my bed. It'll be great just getting back into the swing of things. And if you all are traveling, perhaps some of these tips will be helpful for you. Hope you all have a great rest of the day, and we'll talk again next week.